This short video will show you what to expect during Part 2 of the college's qualifying examination. Part 2 takes the form of an OSCE, or Objective Structured Clinical Examination. The OSCE will assess a range of skills drawn from the denturism competency documents and is designed to assess the integration of clinical knowledge, communication skills, and problem-solving skills in the various practice areas. The OSCE consists of a series of simulated tasks. Each task is referred to as a station. The OSCE stations are designed to assess a number of areas of practice that are outlined in the qualifying examination blueprint. When you arrive at the exam site, you will be asked to hand in your personal belongings, including your cell phone and any other electronic devices.
Hi.
Hi.
So I'm going to need to see your ID, please.
You will be required to show your government-issued photo ID and sign a candidate agreement. You will be given your candidate ID badge, which must be worn at all times, a sheet of labels with your starting station number, a pen, and a notepad. This is all you will be permitted to carry with you during the examination.
My name is David, and I'll be your orientation.
To familiarize you with the OSCE examination process, a briefing will be provided prior to the start of the examination.
OSCE stands for Objective Structured Clinical Examination.
The OSCE examination consists of 18 stations. 12 stations are interactive and 6 stations are non-interactive. Interactive stations have a standardized patient who presents with an issue. The candidate is required to assess the information provided by the patient with the assistance of any props or models in the station, and develop the best treatment plan and/or options for that patient, similar to a consultation. There are no intraoral procedures. Actual models, props, and/or images related to the case are used to simulate the patient's mouth and dental arches. Non-interactive stations may have pictures, models, props, or diagrams, and an answer sheet. The candidate is to identify the correct response, similar to a multiple choice. The OSCE stations are organized in a circuit in numerical order. You will spend 10 minutes at each station. Before the exam begins, you will be shown to your first station. Once everyone is in place, the exam will begin. You will have 2 minutes to read the instructions posted on the wall outside the station. There will then be a signal, and you may enter the station and begin. You will have 8 minutes in each station. Inside the station, the examiner will take your label ID, and then you can begin the task.
Hi, Mrs. Moore.
The examiner is only there to observe. There will be a duplicate set of instructions inside the station in case you need a reminder of the task. In some stations, there will be a standardized patient playing the role of a patient. Models and props are used to demonstrate the patient complaint. There are no intraoral procedures. After 7 minutes, you will be alerted that you only have 1 minute left in the station.
Thanks very much.
You're welcome.
If you finish early, you must remain inside the station. Do not leave the station. Once the full 8 minutes in the station have expired, you must leave the station. You have 2 minutes to move stations and read the instructions for the next station. This process continues until you have completed all the stations. As a reminder, there are no intraoral procedures. At the end of the examination, you will be escorted to the sign-out area, where you may collect your belongings and leave the exam site. To recap, you will have 2 minutes to read the instructions outside the station and 8 minutes to complete the task inside the station. There will be signals to guide you at every stage. If you have any questions about the exam, please feel free to visit the college's website. The website also contains college contact information if you would like to contact one of the college staff members for assistance.